Exactly. Now security/PII. Sorry about that. Add somebody here. Okay, so your PHA is made up of your medical equipment, individual medical equipment. So that's going to be like your eye protection, ear protection, immunizations. So their audiogram. So the first one's like your audiograms and your eye exams. They have to get done. Immunizations, labs, dental, deployment limiting conditions. So if you're LIMDU or LLD, and then your PHA itself. Part 1 and Part 2, since you know everything likes to have different parts, right? Part 1 of the PHA is what? It's the online portion, all those questions they ask you. Part 2 is what? Yep, so that's the screening from the provider, which could be a TCON or in person. Okay. So you had so the PHA replaces the 6120/3, which was your annual certificate of physical condition. The fact that it replaces it means I'm probably not studying that instruction number right there for the NAVMed 6120/3. So that form is obsolete and is replaced by the PHA. All right. Annually, we are supposed to have a PHA. And I think it's on the next slide. Yep, so I'll explain it on the next slide. Performance of the PHA must include their demographics. It is not complete until all matters are addressed. And then it's documented in not Alta anymore, but Genesis, CDA, SNAP, SAMS, MERS. But per instruction, since Genesis isn't in the instructions, you are using Alta. Okay, so this is where I say forget what you do in the real world, because this part right here doesn't usually ever happen. Okay, the thing that gets in the way of that is PRT. Because I'll tell you right now, I was born in December, and I have not had a PHA in December most of my career, if not all of it. So it's supposed to, per instruction, they're not requiring PHA until their subsequent birth month. But the things that gets in the way is we have to have a up-to-date PHA before doing a PRT, and cannot do a PARF-Q without one. So sometimes you will do your PHA early. So for me, I always have my PHA due around August time frame, because I'm due literally right before when we had 2 cycles a year, before the September or the fall PFA cycle. Okay, new accessions and enlisted do not require PHA. So if you have guys coming here straight from core school or boot camp or anything else, they do not need a PHA for up to a year. Reason being is most of the time they're either in a C school or any other kind of status where they're already in that year period, right? So until they get established at their first permanent command and been there for a year, then they will start getting those annual PHAs. Okay, IMR data will be documented in the electronic data system and the member's health record. Where do we check our IMR? MERS and BOL, since a lot of people don't know how to check their MERS and BOL. I don't know how many officers I have to walk through how to check their MERS or their IMR. All right, CO's responsibility. Ensure individual readiness of the personnel assigned to their units. Okay, so it sounds like something that might be overlooked because of the answers sound like they should be the right answer. Sometimes when you're talking about medical readiness or whatever else, it could be easy to say that it's the IDC or it's the SMR, or the SMO or the MDR, right? But even though they are medically related, the CO is ultimately responsible for the individual readiness of personnel assigned to their units. I just don't want y'all to get confused, because on the test, it will sound like it should be a right answer because they're dealing with medical, but that CO has that overarching authority or responsibility. Okay, the forms for a PHA. This one right here is what I call your PrevMed form, your 2766. It's adult preventive chronic adult preventative and chronic care flow sheet. Okay. Now, why I call it the preventive medicine form? Look what word is in the form right there. Preventive, right? So if you're ever confused on what goes on that form, it is telling you exactly what's going on that form. So your HIV testing, your IMS, any allergies, sickle cell, I think asbestos exposure, and anything else that's related to PrevMed health goes on there. Okay, your 2813. So if you're going to know any other dental exam form, you need to know this one. Okay, so Easy 603 is for your active duty. So this is active reserve if you're getting it like out in town. They had to fill out, so if you have a civilian provider, they have to fill out a 2813, and then they bring that back. It's going to make more sense when we hit on that slide on what I'm talking about, but just know that there are two separate dental exam forms. Okay, I believe we have this instruction on your guys' bib, so I'm not going to dig too much in the weeds on it right now. But you're going to need to know your difference between your deployment forms. So this falls under your DHA instruction, which is your 6100.3 alpha, your pre, post, and then post reassessment. And I have a little way to help you guys remember when we go over it on knowing the amount of days that you have to complete each of those. So I'll go over that when we hit that instruction. Okay. Wrong. Cross out that A if you have it on your PowerPoints. What's the Easy 603A? Dental treatment. Again, just a side note, if you guys want to help me, I'm the only one really scrubbing the site, so if you notice stuff like I'm noticing on the PowerPoints that's wrong, let me know so I can fix it, so that way, again, somebody's not getting the wrong information. Okay, and then we talked about this one right here, and then your 6120/4. So this replaces this. So just know that the number 4 is going to be your PHA. The 3 was your your annual certificate of physical condition. Don't get that mixed up with your 6150/4, which was what? When we went over the last PowerPoint, chapter 16, what was the 6150/4? Your abstract of medical service and history. And then your 6150/2 was your special duty medical abstract, right? Simply that 6120 and 6150, I'm saying it now because that might mess you up on the test. So know the difference between those two. Easy way to remember it is, I know it's already been taught in a class and it's common sense. Your instruction number, right, is a 6120 for the PHA instruction. So the form is usually going to match the instruction. Okay? So if it's a 6120, it's going to be a 6120 form. All right, strongly recommended that the member's PCM participates in the PHA process. We know that, right? This is where I'm going to tell you right now, because I like to think of you guys in the real world and not just test purposes. Please, as mentioned before, make sure everything you get medically treated for is annotated, right? Don't suck it up and not say anything, because when it comes to your VA claim time, you want to have all that in your record so it's easier to submit your claim. Your claim could get submitted before you get out, or you can wait up to a year to get your claim actually finished when you get out because you don't have documentation of those treatments, right? So with your PCM, make sure you're telling them everything so they can be documented in your record. Okay? The active duty will have a PHA performed within 30 days of the individual's birth month. Within 30 days. Okay? Reserve members will have PHA performed based on an annual requirements due date. Approved providers. Okay, easy way to remember this. Okay, just think of all the doctors that you have in your med home port model. You have your PAs, you have your IDCs, you have your doctors, and then you have your nurse practitioners, right? So any of those actual licensed providers, and then an IDC, are going to be your approved providers to conduct it. So can a corpsman complete your entire PHA? No. All right. Again, this stuff's not going to be on the test, but know that this is everything that they screen you for during your PHA. That's why you have to make all those stops before you actually have your face-to-face visit, making sure that you are up to date on all categories with labs, EMS, your audiograms, and your eye exams. BMI cannot be self-reported. I know it seems like a common sense answer, but BMI cannot be self-reported. Okay, know this right here, because this has been on the test. Their visual acuity is worse than 20/40. Right, so you're referring them to optometry if their visual acuity is worse than 20/40. Okay. Reserve component members will update their corrective lens prescriptions every 2 years. All right. Service members less than 45 years of age do not require near vision testing. Okay. Service members 45 years or older must be tested for reading acuity. Okay, just know that 45. 45 is one of those golden numbers that pops up a lot in your physical exams. I think it's usually when you're, sorry to say, your body starts deteriorating at certain levels. What's up?
It's been updated to 40 in the last 2 years.
The instruction itself, or just in general?
In general. I don't know if the instructions change or not, but if they're 40 years or older, we test
Okay.
the original.
I'll see if there's an updated instruction. For right now, yes, if we do that there, stay with that. But for like taking the test, if this instruction hasn't changed, just stay with that 45 years or older. Okay, reading acuity, right? So with reading, right, are you going to be reading like this all far away? So never associate reading acuity with distance vision testing. You're going to be doing reading acuity with near acuity cards, right? Reading acuity is with a near acuity card. Now, distance visual acuity is the Snellen chart, the one where you have one eye like this, and you're trying to say what letters are on the wall, and then you have to recite whatever line they're asking you to recite. Okay, contact lenses will not be worn while testing visual acuity. Only exception are mission essential contact lenses prescribed by the government and documented in the record. Okay, now, I mentioned this before. The requirement for 2 pairs of glasses. One of those pairs can be your military combat eye protection. Medical warning tags are required for service members with documented allergies. Okay, so they need to have those red dog tags. Now, as we all know, most commands, some will have their dog tag machine always down. But we have to find ways to get them their red dog tags, especially if they're going to a deployment type platform, because in case they get blown up or get any kind of emergency care, they need to know what allergies that person has. All right, further evaluation and hearing test. If there's no 2215, which one's the DD 2215? I have an easy way to remember it too if you guys get confused. So which one's the 2215? Okay, so again, if you know the words of these forms, it's going to make sense, right? 2215 is the reference audiogram, meaning your reference is the baseline. If I want to refer back to what you first started with, I'm doing there. Hearing conservation data, okay? The word data means stuff gathered over time, right? So your hearing conservation data is going to be your 2216. Reference 15, data 16. Okay, member enrolled in the hearing conservation program has not been seen in 12 months. If you haven't noticed, based off the platform you are on, determines when you're enrolled in the healthcare conservation program. So, here at Portsmouth, do you have to be in the hearing conservation program? Those that are on a ship, anybody on a ship in here? Do you have to be on the hearing conservation program? How long do you have to get? How often do you have to get evaluated? Annually, right? So based off the platform you're in, because of what you're going to be exposed to, determines, right? So if you're on a deployment platform like a ship, everyone is enrolled in the hearing conservation program, and they're evaluated annually. Okay. Now, if they are enrolled and have not been seen within that 12-month period, they have to get evaluated before that PHA is complete. That's with training too, if you didn't realize, right? Those that are on a deployment platform, do we care about HMSB? You guys care about HMSB at the hospital, right? We care more about TCCC, emergency medicine. Right now, you guys are going to be associated with healthcare type care, so that's why HMSB is a huge emphasis at Blue Side Shore Commands, because that is going to be in your realm of what you're going to be doing. And TCCC, but you guys have more emphasis also on the hospital type stuff. Okay, so IMS, needed for deployment, Hep A, Hep B, Tdap, MMR, influenza. All right, your TST. Okay, what form is that one documented on? And I believe it's on, somebody correct me if I'm wrong, because there's 3 different 6224s. I want to, or 4 actually. Is it on the /8? So I think it's on the /8. 6224/8 is your TB questionnaire. Your /1 is your initial. Your /2 is if you have a positive result, and /3 is for all of your treatment. We will go over that instruction again, because it's on your bibs. But that has to be documented for the PHA on your 6224/8. So you'll fill out a questionnaire going over your TB risk assessment during your PHA process. Okay, G6PD, DNA, HIV. Okay, know this one. That should have been highlighted in red. The HIV testing is done every 2 years. Then, what did I say about this 30-day rule? It's going to keep popping up, right? Reserve personnel shall HIV testing if activated more than 30 days. I'm pretty sure, and I know which instruction it's in, the only time you're going to see something other than 30 days is the P117 Chapter 15. There's one that says 31 days or more. I can't tell you which section it is. I just remember seeing that number. Everything else is 30 days. All right, here's that 2813 I was talking about. Reservists can have a T2 exam by a civilian dentist using the DD 2813, but they have to be done at least by a dental officer at least every 3 years, right? So I'll give you an example just because I'll use where I was at. I was at Dahlgren. We had these guys up at AP Hill. So before those 3 years, they can get seen by their civilian dentist all the time, right? But at somewhere within those 3 years, or after those 3 years, they had to come see us at the clinic to get seen by our dental officer to get an actual exam, right? So they can do whatever they want within those 3 years, but if they go past 3 years, they have to get seen by a military dentist. Okay? Members cannot be class 3 or 4 if they want to be deployable. Does anybody, I know we're going to hit this chapter again, but I want to do knowledge checks kind of throughout. Does anybody know what a class 3 is? Yep, it is an emergency, meaning if you do not take care of this, it will result in an emergency within 12 months. That is the exact verbiage they use. Anybody know what class 4 is? Yes. I know some people say unknown. I kind of hate that because most people are class 4 because they are overdue for an exam. They put unknown because we don't know when the last time they got their dental exam, but class 4 is basically you're a dink and have not had your T2 exam. Okay, other factors, limb-due, pregnant, or PEB. Okay. I'm not going to get in the weeds there, but if you ever have the limb-due stuff on your bibs, I'll break it down. There's a process where you have to go through certain limb-due periods, and then it goes to a MEB, or medical evaluation board, and then after your medical evaluation board, it'll go to your physical evaluation board, which makes the determination to keep you or kick you out, or medically retire you. Okay. Framingham risk score is the preferred method to measure cardiovascular risk. Framingham risk score. Okay? Your heart, your health risk assessment tool. Okay, what is that form right there? Yeah, what is that form? Yes, adult preventive chronic care flow sheet, right? Again, without even knowing what the name of the form is, look at what this is, right? It is a health risk assessment tool. When would I want to know a health risk assessment? If they're going to be deploying or anything else, which is going to fall into that PrevMed category, meaning is going to be put on that PrevMed form, which is your 2766. Okay. Assessment of medicinal use will also be documented in 2766 because we want to know what medicines that person's taking so that we can get them that 90-day supply. There's another stuff that's been on the test. There's going to be aware they have a 90-day supply of medication when they deploy. Current PFA must be completed within 12 months in order to participate in the semi-annual PFA. Oh, right now it's annual PFA. I don't know if that's ever going to change back or not, but per instruction, they still have 2 a year. If a PFA medical waiver is needed, it will be documented on the SF600. Okay. I want to get y'all some advice about the PHA part and the PAR-FQ, so that way it's going to help y'all if you're leading sailors or for yourself. Okay. You can be current on a PHA and be able to do a PAR-FQ, but if your PHA goes dink before you conduct your PRT, then you're not able to complete that PRT. So what does that mean, right? Right now, say for instance, it's July and you're asking for me to do my PAR-FQ. And say I'm due in August and the cycle is in September, right? Because you're asking me early to do my PAR-FQ, it looks like I'm good to go. But am I? Because by the time that PFA is conducted in September, I would be dink on my PHA because I was due in August and didn't have it done, right? So you have to project out on that PHA date. So just because now they can do a PAR-FQ, you just say, hey, anybody who was dink on a PHA before September 15th needs to get it done now, right? Because you don't want to fall into a scenario where they said they were good to go and it looks like they're good to go because they do the PAR-FQ and they were dink a couple weeks before the actual PRT. That's where some of those guys fall in the sauce there. All right. Responsible for ensuring is another key word you're going to relate to CO. Okay? A lot of times you'll see CO say responsible for ensuring. They are responsible for ensuring their service members comply with that PHA requirement, the CO. Okay, any member of the healthcare team can identify who needs PHAs, send lists to designated command representatives, perform HREC and dental record review, create an itemized list. So basically we can do everything besides actually signing off that form and being the provider in that situation. And of course, as hospital corpsmen, we're able to do BMI, blood pressure, IMS, eye exams, phlebotomy, and then document referrals. Okay, so I want to hit on this too because I don't want y'all to get confused. Okay, so other than military at your facility, who are also your government workers? Yes, and who else? GS. Okay. Now, do contractors always have to follow all the rules of us?
No.
No, because they follow who?
Your contract.
Their contracting company, right? They run that. Now, GS fall pretty much all in the same rules that we have. Okay. So when we say DoD employees, we are talking about our GS, our contractors, and our military, right? But when it comes to certain things, contractors have to fall still with their contracting company is asking, i.e. training is one of the big ones. Okay, so commission. So your dental officers, your contract dental officers, or contract dentists, and your GS dentists are the only dental healthcare providers authorized to perform a T2, right? I gave that whole part at the beginning because these are all three people you're going to find at your facility, right? They're the ones that are able to provide a T2 dental exam or an annual dental exam. Okay? Reserve and active duty who serve at remote locations may be seen by civilian dentists who can perform 2 exams within 3 years, right? So, it's not saying they have to do 3 exams in 3 years, but when I'm talking about the 2813, they can get seen out in town by a civilian dentist within that time frame, but what are they supposed to be doing after the 3-year mark? Seen by one of these guys right here for the T2 exam. Okay. Any questions on PHA?
How do you know, like, that the test is going to reflect, like, current standards of kind of, like, the PRT style once a year? Like, do you know that it's changed, like,
So, it's the easiest way is what's listed on your bibliography, right? So, and I pay attention to this each cycle. It'll show if there's any new changes, right? So, for instance, your 5100.19, your occupational health manual, that has changed at least 3 or 4 times in the past 5 to 7 years, to where they have the newest updates, where they'll either have a summary of changes on that first page, or they completely rewrote the entire instruction, right? Right now, your nav admins don't come into play, so don't get that stuff out of your head. Your nav admins don't come into play on your bibs, right? So if it's not referenced on your bibliography, then you got to kind of put some of that new shit to the back of your head, right? It's dumb. I know it's dumb because some of the stuff is outdated, but they're only going to test you on this. They physically cannot give you new information. They can't talk about a Genesis thing on the test if it is not referenced on your instructions. And technically, there's no instructions right now that has Genesis in it, right? Or the PFA, right? You don't have the PFA instruction listed on your bibs, so I would stick with the PHA that has not changed, where it's saying that it is semi-annually for that. Yes and no. I mean, it's a myth and truth. There are some questions. They don't always throw out a lot of questions, but if there are some like very obsolete questions or it's really hard to determine if that was the right answer or not, they will throw that out. Everything is on a curve, right? Because if I scored at perfect 80, right, how many questions are on the test? 125, right? So obviously I didn't get 125 questions right because they then either give a half a point for certain questions or they remove some of those questions, and they grade off of a bell curve saying, hey, this is where our highest people scored, this is where our lowest people scored, and that's where they get your percentiles on you scored 80% higher than the average candidate or 99% higher, so on and so forth. Does that make sense to y'all on the questions? Any other questions about PHA? Okay, thank you.
All right, your next